welcome to the Explainer. Look, today we're tackling a topic that honestly feels incredibly intimidating: drug detoxification. If you or someone you love are facing this right now, I know that fear of the unknown can be totally paralyzing. But hey, take a breath because we are going to completely demystify the whole process right here, right now. We're using grounded clinical insights sourced directly from iRely Recovery in Los Angeles. Our goal today? We're going to replace that fear with hard facts and show you exactly how safe, fast, and structured medical treatment really works. Let's dive in.
So, to kick things off, let's tackle the biggest, most urgent question people ask when they are just desperate to get clean. Can I just safely detox at home? Look, I know the temptation is absolutely huge. You just want to get it over with, right? In the privacy of your own space. And it's a completely valid feeling. But we've got to address a very dangerous misconception right out of the gate. Trying to just quit cold turkey without professional medical oversight, it's not just incredibly painful. For a lot of substances, it's a literal life-threatening gamble.
You see, there is just a night and day contrast between these two paths. On one side, you have quitting cold turkey. It's unmanaged, it's wildly unpredictable, and it carries severe, life-threatening risks. But on the other side, medical detox. This is what true clinical safety looks like. We are talking about continuous monitoring of your vital signs, really precise medication management to ease your body down safely, and immediate clinical intervention if any complications pop up. It's the profound difference between surviving a really dangerous ordeal all alone and actually healing in a secure, professional setting.
Section 1. Substances requiring medical detox. So the body's reaction to withdrawal isn't some one-size-fits-all scenario, which is exactly why each substance demands a completely distinct, medically supervised approach. The physical and psychological risks vary drastically depending on exactly what is leaving your system. If we look at opioids, for instance, withdrawal brings intense flu-like symptoms, and these severe cravings that honestly often trigger an immediate relapse if you don't have help. Then you've got benzodiazepines. Quitting those without a medical taper can literally cause life-threatening seizures. No joke. Alcohol withdrawal? That can rapidly escalate into delirium tremens and massive cardiovascular emergencies. And stimulants bring on severe depression, extreme fatigue, and even the risk of psychosis. The absolute crucial point here is that medical supervision isn't some luxury to just make you comfortable. It's a clinical necessity to keep you alive.
Now, we have to add another really critical layer to this whole thing: polysubstance use. When someone is mixing multiple substances, say alcohol and a benzo, or opioids and stimulants, it exponentially increases the danger. It's like a giant, dangerous puzzle, because the withdrawal profiles overlap and they clash, making the symptoms incredibly complex to manage. In these cases, expert medical intervention goes from being highly recommended to absolutely unequivocally critical.
Section 2. The detox process timeline.
You know, one of the biggest barriers to seeking help is simply not knowing what's going to happen to you once you walk through those clinic doors. But I want to assure you, detox is not some chaotic, random event. It's a highly structured, scientifically predictable timeline, and it's broken down into 3 distinct phases: intake on day 1, active detox spanning the first week, and stabilization moving into day 10. Let's break these down so you know exactly what to expect.
It all starts with phase 1, intake and assessment, right on day 1. The moment a patient arrives, the clinical team doesn't just, guess what they need. They conduct a comprehensive medical and psychological evaluation. They carefully review the patient's unique substance use history, their physical health, and they screen their mental health. All of this data is then used to build a highly customized, safe, and totally personalized detox protocol. They are literally mapping out your specific road to safety. Then we move right into phase 2, active detox, which usually runs from day 1 through day 7. This is the part where the active withdrawal symptoms are actually managed. And it's fascinating how precise this is. The medical team administers specific medications, like buprenorphine or clonidine for opioid detox, or really gradual taper schedules for benzos. They're continuously monitoring your vital signs 24/7. Plus, they provide deep nutritional support and hydration. So you aren't just sweating it out in a room somewhere, your biology is being actively stabilized by doctors and nurses.
As those acute symptoms finally start to subside, which is usually around day 5, we enter phase 3, stabilization and transition. The physical crisis is passing, thank goodness, so the medical team's focus shifts. They begin preparing the patient for what comes next. Because look, detox clears the body, sure, but it doesn't magically cure the addiction. So the team works hand in hand with the patient to plan long-term recovery steps, whether that means transitioning into residential treatment or stepping down into an intensive outpatient program. Section 3. Choosing the right facility.
Okay, so now that we understand the timeline, let's pivot a bit. If you are out there looking for a detox center, how do you know if it's actually any good? Well, keep this checklist handy because these are your absolute non-negotiable standards when you're evaluating a prospective facility. First, demand to see their state licensing and accreditation. Specifically, look for the Joint Commission or CARF seals. Verify that they have 24/7 access to medical staff, meaning doctors and nurses are always on site. Make sure they offer individualized treatment plans, definitely no cookie-cutter programs here. And finally, check that they offer a continuum of care, meaning they don't just discharge you to the street when you're done, but they actively connect you to the next phase of your recovery.
You might also come across some heavy clinical terminology in your search, specifically this one right here, ASM 3.5 level care. So ASM stands for the American Society of Addiction Medicine, and a 3.5 level of care essentially means medically monitored intensive inpatient care. Simply put, it means the facility combines high-level clinical and medical intensity with a really warm therapeutic residential environment. For individuals with moderate to severe physical dependence, this is absolutely the gold standard.
Section 4. The iRely recovery approach.
So, how do these rigorous clinical standards actually look in practice? Well, iRely Recovery specifically addresses the biggest hurdles in addiction treatment head-on at their Los Angeles facility. First up, same-day admission. When someone is finally ready for help, literally every single hour matters. iRely eliminates those agonizing admission delays because, let's face it, motivation is incredibly fragile. Second, they integrate structured family communication and therapy right from the start, which really strengthens the long-term support network. And third, they maintain established partnerships with local hospitals. That means if a complex medical emergency ever arises, there's a rapid, seamless escalation of care. It is a highly compassionate yet intensely urgent framework.
And you know, for those in Southern California, proximity really matters. Choosing a facility locally in the greater LA area means faster admission. I mean, you can literally be assessed on-site within hours. It means your family can easily participate in therapy sessions without driving all day. And crucially, it allows you to build real connections within a familiar local recovery community. That alone makes the transition from detox to outpatient care infinitely smoother.
Now, I know exactly what a lot of you are probably thinking right now. There's no way this level of care must be impossible to afford. Let's clear that up right now, because cost should never, ever be a barrier to life-saving treatment. The reality is that most major insurance plans actually cover medically necessary detox under their mental health and substance abuse benefits. It's true. Facilities like iRely Recovery work directly with insurance providers to verify your coverage and handle all the heavy logistics so the patient can just focus entirely on healing.
Taking that first step is actually incredibly simple. Here is a highly actionable, super straightforward roadmap showing exactly how effortless it is to initiate this life-saving process today. Step 1, you just make a quick phone call to admissions. Step 2, they run a confidential pre-screening and verify your insurance right over the phone. Step 3, you arrive for same-day admission and get immediate clinical stabilization. That's literally it. Just 3 steps from a state of crisis to a place of safety.
I want to wrap up this explainer with a really powerful thought straight from the clinical team at iRely. They say, detox is never the end of care. It is the beginning. Detox is a massive, incredibly brave, and absolutely necessary medical hurdle, but it is simply the safe foundation. So, I'll leave you with this question. If clearing the substances from your body is just day 1, what kind of beautiful, lasting recovery could you start building on day 2? Thank you so much for learning with us today.